Okay, let's be honest. Does fetal circulation make your brain hot? Because when I studied this topic, in fact, looking at the diagram, I saw the way the blood was mixing in the heart. I also saw different holes. It felt like plumbing gone wrong, and I was super confused. But then I've cracked the code. So in this video, you'll be understanding fetal circulation and the differences between the fetal heart and the normal heart of a human being. So stay with me, let's talk about it. Now, the fetal heart is different from the heart of a normal human being, not because the fetus is abnormal. Okay, there are two reasons for the differences. One, there are two organs in the fetal circulation that are not yet mature, so they can't fully take up their responsibilities. Two, the mother has already done the job for them. Talk about the fetal lungs and the fetal liver. The mother's liver has already detoxified the blood, while the mother's lungs has oxygenated it. So there's no need to stress this poor baby to do all these tasks because he can't do it. Now, because the lungs and the liver are immature, there are three shunts in the fetal circulation that will help to bypass the fetal lungs and the fetal liver. And these shunts are the ductus venosus, arteriosus, and the foramen ovale. So we're going to be talking about them in this video. But then before we go into the shunts in the fetal circulation, it is important that we understand how the placenta works. Now, basically, the placenta links the baby to the mother, and there is an umbilical cord that becomes the novel when the baby is born. But then there's a twist. In a normal human being, or let's say in our own body, the arteries carry oxygenated blood to different parts of the body, while the veins carry deoxygenated blood back to the heart. But then in fetal circulation, we talk about the umbilical vein and the umbilical arteries. The umbilical vein, which is the biggest of them, carries oxygenated blood, while we have two umbilical arteries that carry deoxygenated blood from the fetus back to the mother. Unlike in the normal circulation where it is vice versa. So now this is what happens. When the umbilical veins carry the blood to the fetus, this is how it happens. Now, the blood is expected to move from the liver, and from the liver does its job and send it to the inferior vena cava. But then this guy is immature and he says, no, I can't do this job at this time. So there has to be a bypass. And this bypass is known as the ductus venosus. Okay, because the fetal liver is immature, it says, no, 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 I don't want to take more blood because I can't handle it. So it now sends it straight to the heart. And it does this by a particular shunt known as the ductus venosus. So what this ductus venosus does is to direct the blood straight from the from the umbilical vein rather, it takes it straight into the inferior vena cava so that he's not going to bother the fetal liver because this guy is immature and he cannot function. That is why the circulation tries to bypass him. So now the blood has found its way into the right atrium as it should be. Now, normally it should go into the right ventricle. From the right ventricle, it should move to the pulmonary artery where it gets to the lungs for oxygenation. But then remember, this guy is immature, so he can't oxygenate the blood by himself. So this is what happens. As the blood is still in the right atrium, there is another shunt known as the foramen ovale. This foramen ovale allows the blood to move directly from the right atrium straight to the left atrium so that the blood is not going to have any reason to go to the fetal lungs. So when this blood has moved into the right atrium, from there it goes to the right ventricle. From the right ventricle, it circulates normally as it happens in the normal human circulation. But then remember that the major aim of having this foramen ovale is to bypass the fetal lungs. So now that the fetal lungs have been bypassed, the blood can now circulate all through the fetal body. Now, there is still one shunt I've not talked about, which is the ductus arteriosus. Now, here is the function of this guy. Because blood from the right ventricle must have mistakenly entered into the pulmonary artery. and is on his way to the lungs. But this guy has said initially that he is not yet mature and he can't do the job. So the blood is already oxygenated from the mother. So the lungs have nothing to do at this point. So it tells the blood, now, since you can't get to the lungs, go straight into the aorta. So now the ductus arteriosus now links the pulmonary artery to the aorta. So from the pulmonary artery straight, the blood goes into the aorta and begins to circulate around the body. Now, when the blood has circulated around the body, it doesn't come back directly to the heart because the fetus cannot oxygenate his own blood. So it takes it back to the mother through the pulmonary artery because the pulmonary artery carries deoxygenated blood. So it takes it back to the placenta where it mixes with the maternal blood, and then it comes back and the circulation begins again. That is all about fetal circulation. But then there's a question I see in your heart, and you want to ask that question. Okay. And the question says, how does the fetal circulation transform and become the regular circulation? Now, this is what happens. Immediately the baby is born, he takes in the first breath, and that first breath of life makes the lungs to expand. And because the lungs have expanded, it will send the signal to the foramen ovale. It tells him, bro, you need to close because you are no longer needed here. If you persist, if you still stay here in this house, there will be a problem for us here. There will be a problem for the child. So that hole in the heart closes immediately. Now, it also sends a signal to the ductus arteriosus. It tells him, bro, there's no need for the blood to move from the pulmonary artery straight into the aorta because can't because the blood needs to be oxygenated in the lungs. So when the blood is oxygenated in the lungs, it goes into the left side of the heart. Because it's no longer needed, a signal will be sent to the ductus arteriosus. It tells him, bro, you need to shrink right now because you are no longer needed. So it shrinks and goes away. And now, what is left is the ductus venosus. Because it's no longer needed, the same thing that happens to ductus arteriosus is also going to happen to the ductus venosus. It's going to shrink. And then we have the names we call all these shunts after the baby is born. The foramen ovale becomes the fossa ovalis because it's no longer open. It's no longer a foramen, so it becomes fossa ovalis. While the ductus venosus becomes the ligamentum venosus, and the ductus arteriosus becomes the ligamentum arteriosus. Interesting, right? Now, this also emphasizes the need for that child to breathe immediately he is born, because if breathing does not take place, all these shunts will not close. So I would I can do a video on that if you want. It will talk about the ABGA score and neonatal resuscitation. So let me know in the comment section if you want me to talk about this ABGA score. And also, even if the baby breathes, there are some rare conditions where these shunts or fetal bypasses do not fully close. And it is related to what we call tetralogy of Fallot. Also, let me know in the comment section if you want me to talk about that, and I'll do a video on that. And in the tetralogy of Fallot, you find out that the foramen ovale is still there, the ductus arteriosus is still there, and then the aorta is misplaced, somehow not located as it's supposed to be. And then we have what we call left ventricular hypertrophy. Left ventricle is the left ventricle becomes too big, so it's not going to function well. That will be the end of our session for today. So do well to like this video and share with your colleagues in nursing school. And if you've not subscribed to this channel, it means that you are likely to miss out on my next video. So do well to click that subscribe button and click on the notification button so that you will receive notifications each time I upload a new video. See you on the next one.